The hour of 9 o'clock having arrived and Representative Levitt having arrived, we will call the House Health and Welfare Committee to order. Yeah, just barely on time. Yeah. So first item is roll call. We do have a quorum present. We do have our chief questionnaire out in another committee, so we're happy to, we can probably move along pretty quick. And so we do have a quorum present, so we're ready for business. First item on the agenda is RS 3371. Representative Redmond. Please state your name, who you represent. You can't turn your face to the camera. You have to look this way, so I know you'd like to be on, but anyhow.
Thank you, Mr. Chairman and committee. For the record, my name is Jordan Redmond, representing District 3 in Kootenai County. Today, I bring before the committee RS 33371. The proposed legislation is part of Idaho's work in scope of practice reforms. This has been encouraged by our federal administration and addresses provider shortages throughout the state, particularly in rural areas. This bill would expand the scope of practice for dental hygienists and all dental services within the hygienist education, training, and experience, similar to the bill House 107, which we passed last year. This bill actually is brought forward because in Idaho's Rural Health Transformation Program application, we did say as a state that we would seek to expand these scopes of practices within our state. Several other states have actually already done this: Montana, Utah, Nebraska, South Dakota, and Tennessee. And again, we stated in our application that we would seek to expand these, and I would ask for your introduction.
Representative Healy.
Thank you, Mr. Chairman, to introduce RS 33371.
A motion.
Sorry, I move to introduce RS 33371.
You're just such a hurry to get everything done, I realize, Committee, we have a motion to introduce RS 33371. Representative McCann.
Thank you, Mr. Chairman. I won't touch that. And good gentlemen. I just would like to just reserve the right during the hearing. I will introduce it, but I do have some questions for the dental board that I've reached out, but I haven't been able to talk to them. So I'll try to talk to them before the hearing. Thank you.
Thank you, Mr. Chairman and Representative McCann. And I look forward to those discussions as well. Thank you.
So committee, not seeing any other lights, we do have a motion to introduce 33371. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. RS 33371 is introduced. Next up is RS 33372. Representative Redmond.
Thank you, Mr. Chairman and committee. My name is Jordan Redmond, representing District 3 in Kootenai County. The next RS, one RS later, is, again, looking at very similar but expanding scope of practice for physician's assistants. Again, this bill would model House Bill 107 from last year, allows practitioners to practice within their scope of education, training, and experience. The other states that have done this: Montana, Wyoming, Utah, North and South Dakota, and Iowa. And again, fitting in with the application that we submitted to the federal government for rural health transformation. Idaho did score very well on scope of practice. However, these were the two items that we did not score as well, and so looking to address that in this committee. I would ask for an introduction.
Representative Healy.
Thank you, Mr. Chairman. I move to introduce RS 33372.
Committee, we do have a motion to introduce RS 33372. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. RS 33372 is introduced. Next up is RS 33381. Representative Burgoyne.
Yes, thank you, Mr. Chairman and members of the committee. My name is Representative Tanya Burgoyne, and I represent District 29. And I am here to introduce RS 33381. This RS is about helping foster children stay in their school of origin, which is whatever school that they are currently attending or that they belong to before they are placed in foster care. And being placed in foster care can be a time of trauma and upheaval for the student. So we wanted to help pass some legislation that would make this a smooth transition for the child and for the family. There's also a new chapter being added about school of origin hearings. If a child is removed from the home, the department will make the decision about their school of origin and placement and notify the parties involved in that decision. So I would ask you to introduce RS 33381, and I will stand for any questions.
Representative Egbert.
I think Representative Healy was first if she had a question. Okay, for a question, Mr. Chairman.
Questions in order.
Thank you, Representative Burgoyne. I just had a question about how this would interplay with 16-1629, which it's talking about how the department, when they're looking at placement, some of the factors that they consider, and it says that they have an obligation to place a child in the placement that's the least restrictive environment. And one of the number one factors that I know they look at is whether there's a fit and willing relative. And that's always the preference, right? Is I think that's been found to also be the least disruptive, is if a child can go with somebody they know. Oftentimes, a fit and willing relative doesn't live anywhere close to the school district, or if the child was being homeschooled, they might not have that same level of training. So I'm just wondering how this would interplay with that.
Representative Burgoyne.
Yes, thank you, Representative Egbert. Can I get back to you at the full hearing if we have one? Okay, thank you.
Representative Healy.
Thank you, Mr. Chairman, for a motion.
Motion's in order.
Thank you to introduce RS 33381.
Committee, we have Representative McCann.
Thank you, Representative and Mr. Chairman. My question is in regard to the fiscal note that says there should be no fiscal note, but my question, I guess, kind of leads back to Representative Egbert. If a child is well out of the school of origin and now has to be transported, who will pay those costs? I'm assuming the department.
I do not know. but-
Representative Burgoyne.
I'm so sorry. Thank you, Chairman Vandewalle and Representative McKen. I do not know, but I'll bring that information to the hearing.
Thank you.
Okay, committee, we do have a motion to introduce RS 33381. Representative Rebel is such in a hurry. She's already leaving the chair before she can get a vote. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. RS 3381 is introduced. Next up, RS 33365. Representative Rubel. Please state your name, who you represent.
Yes, thank you, Mr. Chairman and Committee. Alana Rubel, representing District 18. Have before you RS 33365. This relates to the restoring the FPCS program, the Family Personal Care Services program, which was in effect in Idaho for 5 years prior to late 2025. There is a separate program, the PCS program, the Personal Care Services, which provides support for families who have members with severe disabilities who require a much higher level of care than ordinary. Help going to the bathroom, help eating, help dressing, help with everything. Sometimes help with, suctioning out breathing tubes and feeding tubes and whatnot. A little bit of history on this. Around the time of COVID, it became almost impossible to get third-party people to come into your home to provide these services, and people didn't want to go into people's homes because of pandemic, et cetera. And so this program was set up saying, okay, family members, if you go get the same training that a third party would get, and you learn how to change the feeding tube, and you learn how to do all these things, we'll pay you instead of the third-party person. Very successful program, very popular. There were concerns, however, the department that it was getting too large and too many people were enrolling and the hours were getting too much, and that it was subject to fraud and abuse. So former Director Adams terminated the program with the intent that it be brought back with sideboards. He said, we want to put the brakes on this now, but bring it back with controls on who can use it and how many hours, et cetera, they can use it. That is what this bill is. It is bringing back that program with sideboards and establishing fraud controls within the department, setting a cap on the number of participants at 1,000 families, and setting a cap on the number of hours at 25 hours per week. I know this is a long fiscal note. The issue is that when every hour of this gets counted against your PCS, so this population is already fully qualified for these services to be provided by a third party. This bill says that when a third party isn't available and a family member uses it, those hours get counted against the third party hours. So essentially, if the state is really providing the third party services, it should have no fiscal impact because every dollar of this comes out of the dollars that would be spent on a third party. However, to the extent that they're not able to get third parties because nobody will show up for essentially $15 an hour, then it's conceivable we have a legal problem because every state around us is paying way, way more than we are. And if we were to actually match the amount of what other states are paying to get a third party show up, that would be like $80 million. So I would put to you that actually this program is a real savings because these family members are willing to do the work for $15 an hour. And if instead the state had to pay the $25 an hour that it would take to get someone else to show up, it would cost us a whole lot more money. So happy to stand for any questions and hope we can introduce this. I have never seen a group of families work harder to get help from their legislature. So I hope that they get their day.
Representative Kaler.
Just for a quick question, Mr. Chairman.
Questions in order.
So out of the 1,000 people that would be authorized potentially under this program, what's the determination made about who is eligible for those services?
Oh, thank you, Mr.
Representative Rubel.
Mr. Chairman and Representative Kaler, great question. This bill provides basically a process for rulemaking and to establish a wait list and for the department to set up criteria for that. So that, I don't know that it would be a very long wait list. There are not a huge number of families in Idaho that qualify for this level of care, but they would be required to set up procedures as to how to work through that list.
Representative Redmond.
Thank you, Mr. Chairman. I move to introduce RS 33365.
Committee, we have a motion to introduce RS 33365. Any other discussions or comments? Not seeing any. All those in favor signify by saying yes or aye. Well, when I ask, I say no when to say, signify by saying aye. Those opposed, no. Motion carries. RS 3365 is introduced. Next up is RS 33541.
Thank you, Mr. Chairman, members of the committee. Rob Beiswinger, District 8 from Horseshoe Bend, but represent all of Boise, Valley, Custer, and Elmore counties. Back with a slight revision to the medical freedom expansion bill we brought earlier. This one, the basic change is it takes out the cause of action from it. Just did some talking with some other members. I felt like that caused a little bit of a problem for them. So we pulled that out. Didn't think it was really needed in this bill. The rest of the bill remains the same. This bill just says that schools and daycares will talk about voluntary vaccination. They won't say it's compulsory and then tell you can opt out for different reasons. It prohibits any local governments from preempting the Medical Freedom Act passed last year. There's some technical corrections throughout the bill from last year, just a few things there. And this immunization voting information, or not voting, immunization information system will be an opt-in system versus right now you have to beg to opt out. So it just kind of brings some of those pieces together that we didn't catch last year and just moves us forward in the voluntary vaccination and medication and not compulsory.
Representative Redmond.
Thank you, Mr. Chairman. I move to introduce RS 33541.
Committee, we have a motion to introduce RS 33541. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. RS 33541 is introduced. So committee, that's all we have on the agenda for today. Tomorrow, I've got a couple more RSs, so we finished just in time. Tomorrow, we have a couple more RSs that I want to get introduced. And then we'll start hearing some of the bills that we have and try to move some of this forward because we're getting to the time where if we're going to get it done, it has to get across to the other side. I know the transmittal deadline is like next Monday. I've never seen them actually hold to a transmittal deadline. But, so with that committee, we are adjourned.